good evening. We'd like to thank you for the opportunity to be here tonight, and we'd like to share with you a wonderful positive disruption called Connecting Nurses, and have a little bit of background video to show you first.
Ce qui m'a attirée comme plusieurs infirmières probablement, c'est cette capacité d'entrer en relation privilégiée avec un patient.
At the first, I thought nursing is very difficult, but when I work with people, especially with elder people, I satisfied with my job.
I love to help people, and I can't stand pain, and I'm in a burn center, so it's like really irony that I'm dealing with pain almost every single day.
And I really like to be a nurse, and I'm proud also.
I like to help somebody, so I learn nurse.
Mais ce qui est le changement majeur aujourd'hui, selon moi, c'est l'évolution rapide des connaissances, des technologies. Alors, on doit apprendre à apprendre régulièrement parce que ce qui est vrai aujourd'hui n'est pas nécessairement vrai demain.
It is making translation of science to practice much easier. Now, with the internet, new information is at your fingertips.
A lot of nurses just do it on their own time with their own money. If it's something like that, they'll say, well, tell you what, I'll use my phone and then I'll prove it works and then I'll get the budget. And so sometimes, and I think that is one of the things about being a nurse, is often people do use their own initiative and they put their own resources and energy into something.
We use our mobile phone, although it is prohibited there, we're not allowed to use our mobile phone, but for us as young ages, we use our mobile phones like the BlackBerry in downloading some drug charts or drug guidance.
They learn how to change the work environment themselves around what they feel would be right for the patients. And it comes from that wonderful premise that if you really want something done well, ask the people that are doing the work.
And so you start gathering these things, or you print them off because you can access the sites on the internet, and you can go out and give that information. So nurses are wonderful for wanting to share.
Can we get funding for a global network of nurses, a virtual network where we each upload any documents, any tips, techniques, patient stories, testimonials, whatever comes our way to share with colleagues.
Communicating with patients, having really good rewards from them, like thank you or bless you or anything, it's just rewarding. This is the thing that makes me stay in nursing.
And sometimes I don't think about its money and its salary, but just I think about people who satisfied with me.
I get rewarded every day.
I really love my job, and I don't imagine myself not being a nurse.
The clip that you saw is about nurses, who we are and what we believe. A really important part of this, however, is that nursing is the world's largest workforce, some 15 million strong around the globe. And it's that workforce that has so much to offer. We are basically the unsung heroes in healthcare. And every day we are making a difference. Care Challenge was designed to uncover that difference, to find out what nurses are doing that's making a difference, to find out if what we're doing is innovative, and if it is, how do you share that innovation around the globe? So Care Challenge for us has been a marvelous, marvelous forum to exchange ideas overnight and to have information at our fingertips. Formed through a partnership of 4 international nursing organizations with support from Sanofi, we have been able to create a project that is, actually I'm finding it's remarkable. We invite nurses from around the world using all sorts of different technology to help us, but keeping in mind the work of Florence Nightingale. Florence, as you know, started off by realizing that sanitation would make a difference in whether people survived their wounds during the Crimean War. Her knowledge of that problem was then disseminated in her letters and in her writing. Care Challenge is doing that same kind of thing. We're disseminating information using an international platform. We invite people through blogs, through the internet, through email, through everything we can think of, to submit their innovative ideas. Those ideas are then judged by a panel of nurses from these 4 nursing partner organizations. We select the winners, but all of the projects are uploaded onto the Care Challenge website. And last year alone, in our very first year of getting this off the ground, 150 innovative projects were showcased on the Care Challenge website. And I invite you to go look at every one of them. They will pull your heartstrings. From there, we've decided that they're not just 20 innovations that are worth acknowledging. All of them are worth acknowledging. So this year, as we've continued to roll out this project, we are actively seeking projects from around the globe. They are sometimes a simple innovation, and they are sometimes system changers where an entire country's system of care has been changed because of one nursing idea. That's what Care Challenge is about, and that's why it's so powerful. We're starting to learn whether we can replicate a project in Africa to a project in Morocco to a project in France. So what we'd like to do is start introducing you to some of these projects. This project that I'm starting to show on the slide is from Mike Dino, who's a nurse in the Philippines. He's looked at the problem of aging in the Philippines and the problem of families that don't stick together anymore. So many of the elderly in the Philippines are off on their own, living in small rural communities. And they don't have a good understanding of their healthcare needs. And we need to make sure that those people are safe in their homes, that we maintain functional status, and we maintain their independence. How do we do that? This is what he came up with.
The Philippine population is getting older. According to the World Health Organization, it is a common trend around the world. In the Philippines, for example, people who are 60 years old comprise the fastest growing population age group. I'm Michael Joseph from the Philippines. I'm working as a clinical and research coordinator for the College of Nursing, Ardida Fatima University. The increasing number of elderly in the Philippines poses many challenges, and one of which is the delivery of healthcare services. Most of our Filipino elderly are not self-supporting in terms of their healthcare. By using technologies such as the computers and the internet, we can communicate with our elderly in distant places, and we can, of course, give them healthcare information at a distance. I'm doing a study related to telehealth technologies and its application to the elderly cohort. Telehealth technology is basically the integration of information communication technology to the process of delivering care to our clients. So what I'm doing is that I'm conducting several researches along with my dissertation to explore the factors that affect the behavioral intention of these elderly people to use telehealth technology. The first time that we told them that we're going to conduct a computer literacy program for the elderly, they were very excited actually. Some of them are thinking that computers are only for the youngsters. But I said to them that computers are for all ages, and our elderly can be equally competent in using technologies.
Before we were invited to this program, I used to do this computer, but not so good. When Mr. Michael introduced us to this computer program, I do a lot of things that I never knew before.
At first, we trained them for 6 days on the basics of using computer and the internet. And after that, we exposed them to telehealth sessions with the telehealth providers for another 6 days. And preliminary results of the research showed that only 40% of the elderly have their own computers hooked to the internet at home, and most of them are not using it.
They are very great people. They are very patient teaching those elderly in the computer.
Mr. Michael Dino, when once that he told me about the project, I was very excited to be a part of it, since it would be a new innovation in the Philippines involving the elderly. And I'm excited to see how they will behave in front of these computers. They are excited because it would be their first time to actually manipulate an actual computer.
Actually, this is a life-changing experience for me to work with the elderly because I really ensure that the elderly enjoy the process. But now I can say that I'm the one who enjoyed the data gathering process. This is because this is the time where we discovered that the elderly individuals are such cooperative persons, and they are also funny, and you can learn a lot from them. Making them more functionally independent is actually a fulfilling task, and we feel overwhelmed because of the responses that we, of course, gathered from them. And it's such a wonderful experience working with these people, touching lives, and we're just hoping that they will be more healthier, more computer literate and health literate. I'm planning to put up telehealth centers in critical areas in the Philippines because I consider technology as a life-saving innovation. That's because by using technologies, we can connect to anyone, to any person who are in need of our care.
One idea from one person can make a difference around the world. The outcomes from his project are certainly being tracked by Care Challenge, and those will be disseminated on the platform as we have information available. I want to show you a few of the other projects that have made a difference. Micheline is dealing with diabetes. Diabetes is a global epidemic, as many in the room are aware. And it's a complicated disease to manage, and it's a hard disease to manage when you're the patient because it is so complicated. Micheline has a very interesting project. She's matching patients who have had diabetes for many years and are very successful in managing their disease with newly diagnosed patients. And she's developed a set of protocols and of teaching instruments that empower patients to work with other patients. So it's a real peer-to-peer program that's already making a difference in rural France. And Nikwan has a wonderful project in Cameroon. One of the hospitals there, the Banso Baptist Hospital, had a very, very high rate of infection and had no infection control committee in place or set of procedures. So he's developed a project that he's been implementing over the last few years that has 3 prongs. The first part of the project is they are manufacturing on their own in that country their own hand solution that's alcohol-based for disinfection. And they've done that partially because there just aren't sinks in all of the places where you need to have sinks in the hospital. The second part of the project is a roving trolley that the nurses use when they give injections. Nurses in that hospital, unfortunately, were recapping needles, and so you can imagine that the needle-stick ratio of injury was high. And this cart now allows that sharps container to rove with the nurse. And the third part of their innovation is they've made these portable hand-washing basins that have a bucket at the top with a spigot and then a basin at the bottom that collects the wastewater. And again, these are movable, so they're moving them to different areas where they need them in the hospital, where they don't have the typical sink that you'd think of in a hospital setting. They have reduced infection from 90 cases per 100 to less than 10.
Really, let me tell you now why this initiative is such a shift in mindset for us and also a new patient-centric model. First, because nurses are really key in chronic disease management, patient education, but they suffer from a universal lack of recognition. Connecting nurses brings them recognition, visibility, and knowledge sharing. Second, it's a partnership. It's a partnership with nursing organizations. Why? Because nurses know better than anyone where the gaps need to be filled and where the unmet needs are. For example, did you know that nurses are technology savvy, highly connected on social medias? I didn't. The third is the digital shift of mindset for us. In pharma, until recently, we were more used to manage classical platforms and websites rather than communities and users-generated content. This is also a change for us. So what's next? Well, of course, we're still at an early stage of our program. And we think the potential is huge. The potential is huge, 15 million nurses in the world. So we'd like to give many nurses the opportunity to join the community. And our ambition really this year will be to grow the community so that all nurses can benefit from our services. Second, we'd like to develop new partnerships. This year, for example, we've built a new partnership with Millennia. Millennia is working with the United Nations on the Millennium Goals, and they're working on digital solidarity and gender equality. We'll be in New York at the United Nations in September to present Connecting Nurses with them, and they're really adding so much in terms of e-health, telemedicine. You've seen Michael's program. Clearly, it was the missing piece in our program, the e-health dimension. So we'll be most happy with Phyllis to share with the global healthcare community any creative idea to bridge communities and grow our Connecting Nurses platform. Thank you very much.